My name is Zach Arnold. I'm a Hollywood film and television editor, a documentary director, father of two, an American Ninja Warrior in training, and the creator of Optimize Yourself. For over 10 years now, I have obsessively searched for every possible way to optimize my own creative and athletic performance, and now I'm here to shorten your learning curve. Whether you're a creative professional who edits, writes, or directs, you're an entrepreneur, or even if you're a weekend warrior, I strongly believe that you can be successful without sacrificing your health or your sanity in the process. You ready? Let's design the optimized version of you. Hello and welcome to the Optimize Yourself podcast. If you're a brand new optimizer, I welcome you and I sincerely hope that you enjoy today's conversation. If you are inspired to take action after listening today, why not tell a friend about this show and help spread the love? And if you're a longtime listener and Optimizer OG, welcome back. Whether you're brand new or you're a seasoned vet, if you have just 10 seconds today, it would mean the world to me if you clicked the subscribe button in your podcast app of choice. Because the more people that subscribe, the more that iTunes and the other platforms can recognize this show, and thus the more people that you and I can inspire to step outside their comfort zones to reach their greatest potential. And now on to today's show. Since the coronavirus global pandemic began, there have been countless news stories that range anywhere from, oh, it's just the flu, to, oh my God, they're creating mass grave burial sites. And as we sit quarantined inside our homes, watching the world unravel from our screens, what the hell are we supposed to believe? What can we do to feel in control in a world that is spinning so rapidly out of control? Well, in this interview, I have a very candid and honest conversation about what the coronavirus pandemic looks like on the front lines from the perspective of one physician, Dr. Edison de Mello, who is the founder of the Akasha Center for Integrative Medicine. And yes, for those naysayers, I promise you he is a quote-unquote real doctor. This story today is not the perspective on all current events. This is simply his perspective. And it is an extremely honest, educated, and unbiased perspective on how to better understand what's happening in various different parts of the world, how we can prepare ourselves and strengthen our immune systems naturally, what the timeline really looks like before all of us get to go back to quote-unquote normal, and ultimately how testing is going to factor into this equation as well. I can honestly say that after conducting this interview, I feel more optimistic and less anxious about this whole situation since it all began. This is the best that I've felt since day one. And my hope is that this interview has the same effect on you as well. All right, without further ado, after a brief break to recognize the sponsor of this episode, my interview with Dr. Edison de Mello. To access the show notes for this and all previous episodes, please visit optimizeyourself.me/podcast. This episode is made possible for you by, you guessed it, Ergo-Driven, the creators of the TopoMat, my #1 recommended product if you are interested in moving more and not having sore feet at your height adjustable or standing workstation. Almost every new person that I meet in this industry starts our conversation with, hey, I got a TopoMat because of you. It changed my life. Thank you. If you are not standing on one today, I cannot recommend it enough. It's super comfortable, it's an awesome conversation starter, and by the way, it's also scientifically proven to help you move more throughout your workday. To learn more and get your TopoMat, visit optimizeyourself.me/topo. That's TOPO. I'm here today with Dr. Edison de Mello, who is the founder of the Akasha Center for Integrative Medicine in Santa Monica, California. You are also what I would consider to be a very good personal friend of mine, as well as my personal physician of 15 plus years, has saved my life countless times. I can't even count the number of people in my family who are still alive because of you today. And it is a tremendous pleasure to have you back on the show once again. So thank you for taking the time to be here, especially amidst what is literally a global pandemic.
Yeah, it's always a pleasure to be in your presence, or in this case, via video call, and to help your audience and my audience as well get as much education about what's going on as possible, Zach.
Yeah, so let's do it. What I want to know more than anything is what is going on in the real world that you see every day? Because from my perspective, and from the perspective of, frankly, billions of people, I'm hearing one of two things. Maybe there's a little bit somewhere in the middle, but it's either this quarantine is just dumb. Why are we shutting down the economy for a few people here and there? It's just the flu. And then on the flip side is we're digging mass graves in New York City because so many people are dying and it's this giant pandemic and the world is shut down. What does this actually look like, boots on the ground, for you as a physician that's dealing with this with individuals on a daily basis?
Yeah, that's a very good question. So I think we should all be concerned about what's going on. And we should not at all pay attention to the minimalists out there talking about the fact that this is just the flu viruses. It's not. It's much more serious than the flu viruses. Yes, corona is a family of viruses that cause the cold, the simple cold, that cause the flu. We had the avian flu. We had other epidemics, SARS epidemic. But this is a different coronavirus. This is a virus that jumped from the animal kingdom into the human kingdom with no resistance whatsoever. And so it's a wildfire, and it's destroying anything that comes in contact with a virus or any conditions. Sometimes will, or most of the times, will meet resistance based on our own ability to be immune to the virus. So as more people get the disease, they become immune. That immunity then protects them from getting sick and indirectly protect other people. This is not the case with this virus. This virus has never before infected humans, so we didn't have any resistance. And so it's out there having a party on all of us. And so the idea here is to not at all be less concerned about this as we should be. It's a very regional virus. It's affecting different regions of the world differently. We know this. We see New York having this incredible sad experience with the virus. It's been now discovered and researched that the genotype of the virus that hit New York actually came from Europe. So it was Asia, Europe, the US. And so the virus is behaving a little differently in the US than it has in other countries. And the keyword here is a little different. So we don't get very confused. And in Italy, for instance, and China, the length of the disease was anywhere between 2 and 14 days, with the average being about 11 and a half days. So that's what we were seeing in Europe and in Italy. In this country, we're seeing that people develop the symptoms within mostly 5 to 7 days. And so it's behaving a little differently. There are different areas of the country where we haven't seen a lot of the outbreaks. For instance, here in California, even though we have a population that is twice that of New York, you would expect us to be as affected as people in New York have been, and yet we have not. What's the reason for that? Well, one is that we acted very early on, so we are physically distancing. And later on, I'll explain the difference between social distancing and physical distancing. I refer to it as physical distancing. So here in California, we've been physical distancing now for roughly a month, and it's showing incredible benefits. This morning, a report from Stanford has alluded to the fact that perhaps we had been immune to this virus before in California, meaning that the virus outbreak started in roughly October of last year in China. And because of a lot of travel between California and China, specifically in the cities where the outbreak happened, there's incredible commerce going on between those two cities, Los Angeles being one of them, kind of a very strong port of entry for Chinese goods and for travels. So we are now, or they are, in Stanford now testing several hundreds of people to determine if they were immune before the disease happened, that we didn't even know, because that would account for why we are seeing less outbreaks in California. So there are a lot of theories going on out there. But the one that I believe we all need to stay really clear about is the scientific evidence showing that this virus is very serious. And once it enters your lungs, its mission is to destroy the lung architecture, to destroy the alveoli. And so I am urging all of my patients to be very, very careful and not to relax about physically distancing from each other.
Got it. Well, there's a lot to talk about there, and I definitely want to get to the individual side of this next, because at the end of the day, I think most people, if their most acute concern is what happens if I get it or a family member gets it, what is it going to look like? But one of the things that I want to point out very quickly, going back to this global view of it, where you said it's very serious. I have a dashboard that I was sent a couple of weeks ago. I don't know who put it together, some guy that's really good with numbers and algorithms, but it essentially is a dashboard of as close as you can get to real-time statistics, broken down by percentage of the total number of cases in either a country or an individual state, the number of fatalities, as well as the number of people recovered. So for anybody that is listening to this or watching it, the address is ncov, as an NCOV 2019.live. And it also calculates fatality rates. And I've noticed that this number is slowly climbing up. So for example, and again, this is one person's site. A lot of it, I'm sure, is verified by a lot of the other data that's out there. But in short, looking at it right now, as of recording this episode, the fatality rate worldwide, it calculates at 7%. In the USA, it has 4%. In Europe, it has 9%. Asia is 4%. So like I said, it does it by continent, it does it by country, a whole bunch of data. And it's really, really interesting. But the reason I bring that up is not to get into the specific statistics, but it's to show that that fatality rate is astronomically higher than just the flu, correct?
Exactly. And that's where people are, including some leaders out there, that people are giving out the wrong information. They're saying it's just the flu, it's just the cold. In reality, yes, the virus that causes the flu, that causes the cold, comes from the same family, coronaviruses. And it's called corona because it resembles a crown. So in Latin, a crown is corona. And so with spikes, you've seen the pictures of the viruses everywhere, but it is much more infectious than your common cold or flu virus. And once it gets into your lungs, its ability to destroy the lung architecture and to invade all your components of your lungs is very different than your common cold or flu viruses. So, and that's why we're seeing all the deaths out there. So be careful.
So as somebody that's on the front lines that can help me dispel myth from truth and all of these news stories and all the quote unquote fake news, and like it's trying to get an idea of what this really looks like through the media is literally maddening. So as somebody on the front lines, let's forget that the news even exists. I want you to describe what this looks like in your world right now on a daily basis.
Okay, so it looks scary when you think about, again, it's regional. And because I've been doing telehealth for a number of years now, I have quite a number of people that I see in New York, for instance, through telehealth. And it's also where I did my medical training. So some of my original patients there kind of followed me when I went into private practice. And so those people are the ones that I consult with via telehealth. And half of my patients with it are in New York with the virus. I currently have about 23 patients that I'm treating. It is very scary. It's not to be taken lightly. People cannot breathe. There's a sense of despair when you cannot breathe. And because you're feeling desperate, your cortisol goes up, which interferes with your breathing even further. There's a sense of a tightness in your chest that people experience, and they relate to it as something that they have never experienced before. They lose their wind. They lose their ability to breathe in, to bring in the oxygen that they need. The fevers are high. You can go as high as 104. They have pain everywhere, and musculoskeletal pain can be very, very disabling for people. Some people have a lot of gastrointestinal discomfort, including diarrhea and abdominal pain. There's headaches, but most of all, there's a sense of that they just feel like they were run over by a truck, that they feel so bad that there's no energy left in them to take care of themselves or those who depend on them. So, and again, and it varies from the very young to the very old. You have people who are below 40, below 50, who are not having a severe effect of the virus as others. But what's out there also sometimes defines the previous notion that we had, the young people don't get it. I have a 28-year-old right now who's in very bad shape. And then you need to think, why is that? Well, he doesn't have any pre-existing medical conditions, but he's a smoker. And so that you go, oh, okay, so it is. Even though he's young, he's 28, doesn't have high blood pressure that we know of, doesn't have diabetes that we know of, doesn't have a history of having a lot of pneumonias. So he doesn't meet that criteria, but yet he smokes. And that's what we're seeing a lot is men who smoke, men and women, but specifically men at a higher risk. We know that men are getting sicker more than women. And in my sample of the patients that I'm treating, that has also been proven to be true. So it's a very small sample, treating 23 people. When you have thousands and hundreds of thousands of people get sick out there, my numbers are very small. But what I'm seeing is actually being verified or moving along with current statistics that show women are more protected than men. Men get it at a higher rate than women. And we believe the reason for that being twofold. One is the fact that women's estrogen is protective. And certainly men don't have as much estrogen as women. And the other one is lifestyle. Men tend to have a less healthy lifestyle than women. So at the end of the day, what we're seeing is that women are accounting for roughly 30% of all cases, and men roughly about 70% of the cases. And of course, in some regions, that is less the case. But overall, when you look at statistics, it's about 70 to 30 men versus women.
So of the people that you're treating, are you doing 100% telehealth? Or in California, are you going to local emergency rooms and ICUs and treating people in person as well?
I'm doing mostly through telehealth. I do volunteer my services with the homeless population. So in those cases, I go into a facility and I wear protective gears and then I do my work with them. So that's the work that I'm doing in the forefront. I did have a couple of visits to the ER where I saw patients, but because of the lack of gears available for everybody, I decided to step out of that, let the infectious disease specialists do more of that and focus more on the patients who are in the hospital, but not dealing with COVID and also dealing with the homeless population through the free clinics. But overall, what we're seeing is that that's what I want the audience to hear, that most people are recovering. There is, yes, it's a serious disease. Yes, it can be very debilitating. The whole country is shut down. The whole world is shut down. I recently saw the cover of The Economist magazine, and it was a picture of the Earth, with the sign that says closed. And I mean, not in a million years would I ever think that I would have this experience of looking at a magazine and realizing that the picture that speaks 1,000 words is really telling us the whole world is shut down. So this is something that we've never seen before. And it's something that hopefully moving forward, we can learn. But out there, I'm seeing people in the homeless community, and until recently, people in the ER. And even the people in the homeless community are recovering. The ones that are not recovering are the ones with very serious pre-existing conditions. People who are not taking this very serious and is out there is still doing their lifestyle as if this is not the new normal. Those people who don't have healthy lifestyles and therefore whose immune systems are not as strong other ones who are having more of a difficult time recovering. So far, out of the 23 patients that I've had, 10 of them are now almost fully recovered. And so that's a very good sign. And the other ones are on their way to a full recovery. And I'm very optimistic about that.
And of those 23, have any of them ended up in ICUs on ventilators and all of these horrific stories that we hear online, or are they all people at home?
Yes, 3 of them required hospitalization. One passed away. It was a woman who unfortunately had just recently recovered from lung cancer. And she was post chemotherapy, so she was immune compromised. And when she got it in by being exposed at a hospital. Then we knew that that was going to be probably the end of her life. So she passed. There's a gentleman that is in a ventilator in New York. Again, he's a 79-year-old with a pretty bad case of diabetes. So that unfortunately, the virus, like a lot of us, love sugar, and there it is, right? With diabetes. And then there's another one who went into the hospital but has not required ventilation. So he hasn't been ventilated yet. So out of the 3 people that were in serious condition, one was a woman and 2 were men. The female patient unfortunately passed away. The other ones, one is recovering as well as he can in the ventilator, and the other one is being observed at a hospital setting.
Got it. So I have no interest in politicizing or talking politics at all. I hate doing that vehemently. So we're not going to go there, but I want to use politics as a way to get to our next question a little bit. So going back to this idea of we're seeing these 2 extremes from the media and from the news about it's just the flu versus mass graves and everything is going to crap and we're closing the entire earth down, right? So now talking specifically about hospitals. Within the same span of me doing a scroll on my phone for 10 minutes, I found 2 extremes. One is, oh my God, like it piles of people. We don't have the room anymore. We need all these ventilators. And then the other side is, well, we just built all these extra triage units and we're already closing them down because we have no patients and there is no pandemic and everybody overreacted. So I know you're not necessarily in the ERs and the ICUs every single day, but you know a lot of people that I don't know. And you hear stories. So what, in your interpretation, and again, it's your interpretation and there are different stories everywhere, but in general, what's your understanding of what it actually looks like at the hospital ICU level? What does it look like in your world?
It depends on the area that we're talking about. Like I said, it's very regional. In California, we are in very good shape right now. I just spoke with somebody who works with me. She's a nurse at USC. And she said they're in very good shape. She has all the equipment that she needs. They have a system that is working. They're only testing people who are really getting sick. Everyone else, they're recommending that they stay home and try to ride their wave with the doctors until the doctor tell them that it's time to go to the ER. So this is USC. She's a critical care nurse, and she's very confident of how things are being handled there. UCLA, the same thing. Cedars, the same thing. We are well prepared. There was initial shortage of some of things that we needed, specifically than N95 masks. So far, that has been resolved. Should we have the peak of the disease happened here in the state, I think we would be in a much better position than New York was. And I don't think we will see those peaks very high because so far California is showing the flattening of the curve. And so I feel very confident about what we have done here and what our governor and local officials have done to stop the spread of the disease. New York is a different story. New York, even though it's half of the population of California, it's very dense. And there was a massive need to use mass transportation. And if you've been to New York, it's impossible not to run into people, rub through people in the streets because of the density of the city. And so there, it's absolutely correct. The disease is spread so fast that there was no time for us to spread out the number of people utilizing the medical system. The problem here, it's not that the disease is so severe that we all have to be under quarantine for months on end. The problem is that if all people who get sick require hospitalization as they did in New York, not all, but a great number of them, we don't have enough beds to hold the number of people at one time. So the idea of physical distancing is to spread out the transmission of the disease, to give the hospital facilities time for us to prepare for the patients utilizing the services. So when you hear political leaders saying it's just a flu, let's open up the country, unfortunately, they do not understand the epidemiology of disease. They don't understand. If you have a leader who is a bit more educated in medicine or nursing or your basic virus or disease transmission, you can see that they wouldn't be making those statements. The statement comes out of complete ignorance and complete lack of leadership, in that it's not all about the economy. It's about not overwhelming the system so that the economy can eventually recover a bit better. And that's what they're not saying. We are saying that this is not a disease that is going to kill everybody or that make everybody sick. What we're saying is that if we don't have a way to slow down the spread, to give hospital facilities time to prepare, then we're going to have to come to the decision that New York has come in deciding who gets a ventilator and who doesn't, which for those of us in medicine, it's a decision that we really have this incredible anxiety about having to make, to decide who gets a ventilator versus who doesn't. It's just not the way the system should be operating. So slowing down the disease is the best way that we can enforce right now to protect society, to protect our families, to protect the economy in the long term, and to give hospitals and healthcare workers a chance to be better prepared to care for people.
Right. So really on the individual level, anybody that feels like this is the bubonic plague and it's going to wipe out all of humanity, that's clearly not what this is about. It's more about making sure we can manage and minimize our ability to deal with this brand new disease until we're able to either find a vaccine or develop our own antibodies and immunity. So it's more about management and making sure we minimize the amount of people that we wouldn't be able to treat otherwise, but it's not, oh my God, like there goes the human race.
It's not. And again, to your audience, I want you guys to really hear this. My sample is very small, but here I am with 23 people. 10 of them are 95% better. That's incredible, with no foreseeable complications. I'm not seeing any of that. The other ones are recovering, are on their way to recovery. Yes, it's a disease that's very scary. It affects your lungs severely. You're coughing, it's a dry cough, you have high fevers. But if you are strengthening your immune system, if you are doing everything under your power to maintain physical distancing, to strengthen your immune system, should you get the disease, the tendencies or the probability that you will recover is higher than not. The problem is that there's a lot of websites and a lot of people out there putting out wrongest information, very wrong information, saying we have a cure. This is how we prevent the disease. There's no cure right now. There's no prevention. What there is a need for all of us to strengthen our immune system, to make it even stronger than it may be right now, so that it can fight the disease better, so that if you get it, your symptoms are not going to be as pronounced as people whose immune system are not optimal. And there's also misinformation out there about using the malaria drugs and using the lupus drug to treat it. And, pharmacies are compounding this. And I think this is adding to the confusion that those drugs are currently still being investigated. The malaria drug, the chloroquine, they are all under investigation, and they're being used in the hospital setting for people who are severely ill. Because when you come into the hospital as a patient, you're severely ill, we doctors have to do everything under our power, in our power, to be able to save your life. And if chloroquine, the malaria drug, is one that we're going to use, then let's use it. But the side effects of these drugs are really strong, and it affects your heart. So I'm telling people in my community, my patients, trying to educate people to not make the mistake of insisting on having this prophylactically, meaning to prevent disease, because it may prevent you from getting the disease at a very high infectivity rate, let's say. But then at the end of the day, you leave the condition with a bad heart. And so it's not really worth it. And your best choice is to find a practitioner through telehealth that you trust and to let the person be guiding you on what happened if you were to get sick.
Yeah, this is the perfect segue into the next two areas that I wanted to talk about. The first of which is, I don't want to use the word prevention because it's a virus and we can't just prevent it, but being able to minimize whether or not you may or may not get it because of the strength or weakness of your immune system. What I don't want to go into is the same advice that everybody has told us 1.5 million times on the internet. I know at this point I need to wash my hands. I shouldn't be around people and I shouldn't be hugging them and I shouldn't be going to concerts, right? All that stuff is obvious. So assuming people are aware of the obvious things that we have all been told to prevent the transmission of this disease, let's go into the nuance that most people are not talking about, which is how to actually strengthen your immune system. What things do we have control over in a world where we feel like we've lost all control? What can I be doing from home right now to make me feel like I'm just doing the littlest bit to lessen my chances of this happening to me?
That's a great question, Zach. Well, there's several things. I'm going to start with one that makes whole big sense to me, which is for you to calm your immune system. When you calm your immune system, when you express gratitude for your health, for the fact that you can be, quarantining in your home, that some of us have support around us, that you're not sick. For those of us who are in California, California so far is showing that we have been able to flatten the curve. When you sit with this, the feeling of gratitude, the feeling of relaxing your system, you decrease cortisol. And cortisol is the stress hormone. Cortisol is the hormone that reigns in everybody's parade. So no matter what you do, if you stress, you're going to be tied up. And when you're tied up, you cannot breathe, because you are completely constricted, your blood flow is constricted, and your immune system suffers. So find a way to meditate, find a way to laugh. This is a time for you to perhaps, go see or watch your favorite comedies and create games with your families, laugh. They have laughing clubs in India. The reason for that is because laughter increases endorphins. Endorphins are incredibly helpful to strengthen your immune system. So first and foremost is your mental health. What are you doing to improve your mental health? Then you go to the immune system. What we know is that vitamin C, it's been around for a long time. In 1970, Linus Pauling won the Nobel Prize showing the benefits of vitamin C to treat inflammatory conditions, specifically colds and flu viruses. It doesn't necessarily prevent it, but it does slow the progression of the disease and it shortens the length of the disease. So vitamin C is extremely important. And in fact, they are now testing IV vitamins in Italy and also in China. So I recommend 2,000 to 3,000 milligrams of vitamin C a day in 2 to 3 divided dosage. So if you're going to take 2,000, 1,000 in the morning, 1,000 in, maybe with dinner. Always try to have some food in your stomach, given the acidity of vitamin C. So vitamin C is highly recommended. The virus creates something called a cytokine storm. Cytokines are chemicals on the viruses that allows transmission faster. And it creates this array of inflammatory cells. They're duplicating themselves. It's called the cytokine storm. NAC, N-acetylcysteine, has been one of the supplements that we've been using to help basically not fight off, but to deal with the cytokine storm a little better if you were to get the disease. And the dose that I'm recommending is 600 milligrams, 2 to 3 times a day. So 12 to 1800, 18 is better, is what I'm recommending for vitamin C. The herb quercetin is also being used with very, very good results so far. Again, It's not being used as prevention. There's no prevention, but it's being used to strengthen the immune system. And quercetin is also one of the herbs that will have a positive effect on the cytokine storm, the amount of virus. It's called viral load that we may get. So NAC is extremely important. Zinc, because it fights viruses. I'm recommending zinc, and I'm treating my patients with zinc. And I give them anywhere from 20 to 30 milligrams a day, always with some food in your stomach, because zinc can make you really nauseated. So zinc, it's also been something that I've been asking people to take to help them strengthen the immune system. Certainly gargling, right? Using a lot of something that you feel comfortable with in gargling. Why? Because the virus aggregates in your throat. We all know about strep throat, and when we get any viruses or bacterial infection, sometimes we have scratchy throat. And then by gargling it, you can not necessarily stop it, but again, you can decrease the length of the disease. I personally use a product that we developed called Throat Support. It has echinacea, golden seal, it has other herbs, and I use that. I've been using that since we launched. Every cold season or every time I feel a cold coming in, I will do that. And there is a benefit in delaying the progression of viruses and colds more readily. If you don't have throat support, you can do with warm water, a little salt, and a little vinegar. Make sure that you don't use a lot of vinegar, but just a little bit of it, because vinegar can affect the enamel of your teeth. And so you have to be careful. But I tell people to get, maybe a half a glass of water, Zach, put a teaspoon of salt, put a tablespoon of vinegar in warm water, and gargle and spit it out. We've been using that. Because the virus also has a predilection to your nostrils, to your sinuses, I've been using eucalyptus oil. Eucalyptus oil has the benefit of really opening up your sinuses. And so when you put eucalyptus oil right by your nostrils and you breathe it in, you can see that it really opens up your lungs. And it's also been helpful for people who feel a little congested in there. So eucalyptus oil has been a good thing that I'm using for them. I'm telling people to breathe, to do breathing exercise. And by that, I mean to go take anywhere from 3 to 5 breaths in, and you count to 3 or 5, and it goes like this. And then you hold it, and then you hold for the count of 3 or 5, and then you let out through your mouth. Those are lung exercises, and it opens up your lungs to oxygen. If you feel a little congested, have somebody who you're quarantining with do what's called chest PT, chest physical therapy. And it's basically cupping your hand and tapping people in the back. And it really making that sound kind of like you're burping a baby after you feed the baby. That's the idea. Pretend that for those of us who have children and we used to feed our kids and we had to burp them. So that's what you're doing, cupping your hands and doing what's called chest PT. Sometimes lying on your front on a couch and open your arms sideways and breathing can also be good. Standing up, doing exercises at home, stretching, all of the things that you need to do to decrease anxiety and increase oxygenation. One of the things that I've been doing with people who have the chest discomfort with COVID is not only to do those exercises that I'm discussing, Zach, but also to use an oxygen can. You can get it on the internet. It's a can that you have it available. If you start feeling you're lacking a little bit of air in your lungs, you can use the can to bring in oxygen. The virus, we know, is very sensitive to oxygen. And so it also opens up your lungs and your nostrils and give you a sense of that you're doing something to combat it. And there's other things that you can do. Eating a healthy diet. Please, I know we are all quarantining at home. There's not a lot to do. And so eating, sleeping, exercise, some of us are working. But you can find a way. Maybe this is a time for you to try a healthy diet. You're home anyway. So why not try a healthy diet? Decreasing, if not eliminating, your added sugar at all costs is highly recommended. Of course, alcohol. We all want to have a little drink to help with the stress, but alcohol is an immune suppressor. So if you're going to have alcohol, have a glass of wine with dinner and try to limit that for now until we know more about where we're going to go with this. So those are some of the things that I'm prescribing to my patients.
All right. So there's a lot of stuff to unpack in here, like a whole laundry list of good stuff, a few of which I want to pull out and extract. And then I want to do a very simple summary point by point for people. And I'm also going to put a detailed list in the show notes. So for anybody that for the last 15 minutes is like, oh my God, I've got a lot I need to get done. I'm going to organize it very succinctly, but a couple of the ones that I want to pull out, you mentioned specifically the throat support. I will tell people that as an N=1 experiment, that stuff is magic. I have used that at your behest in the past. And as soon as you feel that little tickle in your throat, you do this for a couple of days. And it's for people that want to visualize it, it's in an eyedropper. You just put it under your tongue for 15 or 20 seconds. You're done with it for the day. But then all of a sudden you're like, wow, it's not getting any worse, as opposed to that feeling of, yep, I'm getting sick, it's coming on. It ends up not coming on. The one caveat to it that you forgot to mention with the ingredients is that the additional flavoring ingredient is the bottom of a shoe, because that stuff is not very tasty, but it's incredibly effective. But boy, does it taste like licking somebody's shoe. Whoa, that stuff it's something else, man. But I can wholeheartedly recommend it. I always have a little eyedropper bottle in my supplement cabinet. So as soon as the tickle's there, bam, throat support. I don't even think about it anymore. The other one that I wanted to mention that doesn't require purchasing anything, because I know that some of these, if we were to do everything you recommended, or not everything, but a fair amount of them, that's going to cost money, which is a huge concern for people right now.
Yes, absolutely.
The cupping exercise specifically, I want to talk about this one, because when I had my last appointment with you in person, which was before all of this, I think it was maybe 2-3 months ago, you actually proved to me over the course of 60 seconds how this worked. You used a pulse oximeter on my finger. And for those that are unfamiliar, a pulse oximeter is that little thing that they put on here, and they can measure the oxygen saturation inside your blood. So I had a very high oxygen saturation already, but me, I don't want to be 97% or 98%. I always want to be 100, always looking to optimize. You're like, well, it looks very good right now. You're at 97 or 98. And you did the cupping experiment for like 15, 20 seconds on my back, and my number went up 2 points. And you're like, there, now you have more oxygen in your blood. And I was like, that's fascinating. So the cupping exercise really makes a difference. And you also should mention as well that even if you have little bits of mucus or phlegm or anything on the lungs, that also is going to help clean some of that junk up, correct?
Yes. Oh, yeah. Because your lungs, that's a very good point, Zach. Your lungs are, we are producing mucus all the time, which leads me to also add to the list of dietary suggestions for you to decrease dairy. Anything that causes mucus, and dairy is a big one. We all have a little throat thing, some of us when we eat cheese or drink milk or any dairy product. Why? Because it produces mucus, and you can see that dairy in of itself is very creamy. At times after you boil your milk or whatever, you can see that stuff comes up to the surface. So imagine what that does in your lungs. So the idea is to decrease anything that you consume that could add more mucus to your lungs. And when you do the tapping, what you're doing, you are dislodging those mucus plugs, so to speak, from the little bags inside your lungs called bronchioles. So you have a big bag called the lungs. The lungs is just a big balloon, and inside the balloon, that big balloon, you have little tiny balloons called your bronchioles. So that's where bronchitis comes from, is when the bronchioles are infected. And those bronchioles is where the part of the lungs that capture the mucus. So by doing the cupping that I did for you, Zach, what I'm doing is I'm dislodging the mucus from the bronchioles, therefore more oxygen coming in to your system.
Got it. Okay. So what I want to do next is I want to do a very, very brief summary of the list of supplements specifically. So if you were going to do like a prescription, so to speak, and once again, I want to give a very clear disclaimer that yes, you are a licensed medical professional in the integrative medicine community. You're frankly one of the best and one of the godfathers of this entire new system of medicine. However, I'm sure you would say the same thing. Check with your own physician and make sure, to not to take our word as gospel, so to speak. And you should always do your own research and take care of your own health. But with all those disclaimers in place, if we were going to do a bullet point summary, it was vitamin C and zinc. Like just very, very quickly, give me a quick prescription for people that want to supplement.
Sure, sure. And I love your disclaimer there, your reminder. And contrary to what most of us think, herbs and vitamins can indeed interfere with medications that you might be taking. So it's not to be taken lightly. So, Zach, thank you for that disclosure. And I couldn't agree more. You must always check with your physician or your healthcare practitioner when you're going to add any supplements to your regimen or if you're taking medication. So, on top of my list, however, is decreasing your anxiety. Number two is adding vitamin C. It's extremely important, 2 to 3,000 a day in 2 to 3 divided dosages. Using throat support or anything that you can use to help you basically cleanse your throat and spill it out. Do that 2 to 3 times a day. That's extremely important. Zinc, I like 20 to 30 milligrams a day. It's been very effective fighting viruses. So zinc is also very, very good. There's an herb called astragalus. It's a Chinese herb that's been around for thousands of years with very good clinical evidence to fight upper respiratory infections of any kind. It's called astragalus. I like that, so I take that every day in a product called Immune Support. So I take that when I see something coming up. I feel like I'm dealing with an allergy. I don't know if it's allergy or if it's a cold coming on. I'll do Immune Support 2 tabs 3 times a day. Vitamin D. There was an incredible study that came out from the university in Italy showing the benefits of using vitamin D to help fight the virus. And I'm using vitamin D 5,000 milligrams a day. For kids, I recommend 2,000. And that's a very easy way of, if you're low in vitamin D, is for you to supplement it. Now, vitamin D has a very huge range. It's usually 30 to 100 is the level that you want to have in your body. 30 is too low, 100 is too high. So I always recommend that people be in the middle. If you take 30 and you add 100 to it, which is the other extreme, it's 130, the average would be 65. So your vitamin D should be anywhere between 60 and 70. That's what I'm recommending to make sure that you know your vitamin D levels. So that's also very important to take. And also making sure that you stay well hydrated. Now, very well hydration. Now, sometimes they say I'm drinking a lot of water and I'm still dehydrated. Well, sometimes when you drink water like you're drinking right now, it's also good to add a little tiny bit of minerals or even a little tiny bit of juice that you like. This is not throughout the day, but just maybe the 1 or 2 glasses of water. You add a little bit of juice or a little bit of your amino acids because that will bring the water into a compartment in your body called the intracellular compartment. And the intracellular compartment is where your cells need to be well hydrated. And so they will push, if you add some minerals and a little bit of good glucose to your water, it's going to pull the water into your intracellular space. So drinking water, being well hydrated, drinking tea, it's also very well recommended. Keeping your body warm, Zach. Make sure that your body is warm. This virus hates the heat. We know that. The virus dies at 56 degrees centigrade, which is about 130 degrees Fahrenheit. So, of course, you're not going to have our house be 140 degrees. If you have an infrared sauna, if you have an infrared blanket, if you have a steam shower, I recommend that you do that at least once a day because the heat really, really protects you more against the virus. And that's one of the reasons why I also recommend that when the sun is out and you're socially distancing, to spend at least 20 to 30 minutes a day out in the sun. Certainly use some sunscreen in your face, but leave your arms and your legs without sunscreen so that the UV light, which has been shown to kill the virus, can also have better penetration in your system. So those are just some of the things that I recommend. I'm going to send an article that I just finished writing where I describe all those recommendations and I list the research on it and whether or not it's being used empirically, meaning under research studies, or if it's being used basically anecdotally, meaning doctors are using it because they have a suspicion that it may work because it worked with other viruses. I'm going to send that list to you so that you can post it to the audience.
Excellent. I will definitely link to that in the show notes so somebody has a nice visual summary of everything that we're talking about, because there's so much good information in here. So the next direction that I want to go, which I think is probably where most people are right now, which is the just staying sane stage, right? And yes. I think that unfortunately the prescription contradicts everything that you just said, because the prescription for staying sane at home is wine, mint chocolate chip, and Netflix, right? So I think that it's easy for somebody to listen to this and say, yeah, of course I shouldn't be drinking. No, I shouldn't be eating ice cream. Of course I should be having a healthier diet, but I just can't because I just don't care because I'm freaked out and I'm stuck at home. So what small behaviors or things can people do to start regaining some sense of sanity and control so they can stop using these coping mechanisms that are, of course, doing the opposite of what they really want them to do?
Excellent question. Wow, you're the master of excellent questions there, Zach. Thank you. I think it's for you to really count your blessings, because what we go into despair when we think about of the worst cases. That's the human experience. I refer to it as the human suit. We go, wow, the world is coming to an end. I'm going to get this anyway. The economy is completely down the drain. I don't know what's happening, so who cares? And that happens when we don't have a sense of hope. And I'm here to tell you that there's light in the end of the tunnel. And so just when you go into that desperation, that anxiety that I have sometimes when I need to go out there, just stop, close your eyes for a minute and say, what are my blessings? What do I have going on for me? My kids are healthy. If you have kids, my parents are healthy. If your parents are still around, I am healthy. I am trying to get as much help as I can. You list your blessings, and then you list the things that you are concerned about. And then you see which list has the bigger number. And for most people will be the list that says, here are the blessings. Here are the things for me to be grateful for. And so when you do that, then the need to self-medicate with the chocolate chip cookie or the ice cream, which I personally love, but it's not good for you, somewhat decreases. And I'm not saying don't eat this at all. We're being realistic, right? We are, like you said, we are hunkered down. We are concerned. We are like, what's going to be next? But do it moderately. Ask yourself, do I need to use 2 scoops right now? Or can I just satisfy myself with 1 scoop?
You meant pints, not scoops, of course.
Okay, in Zach's case, pints. See if you can have a piece of fruit instead. Your brain wants the sugar. And so sometimes try an orange, try an apple. You say, let me give this to my brain and see if it wants more. And so do that before you have the ice cream. And if you still need the ice cream later on, the need to have an increased amount of sugar is somewhat decreased. But the thing that I tell people that I think works really well, and some of us are not doing it, is whenever you have a sense of that you need to have sugar or you need to drink, is for you to actually drink water. Right? Because when you have that water in your system, your body's need for sugar, for anything else you need to do to kind of, enhance your sense of feeling safe or self-medicating is somewhat decreased.
The last area that I want to talk about a little bit kind of brings us back to the very beginning, and something that you said kind of offhand, but I think is also very profound, is the joke that you made about, well, I'm not calling it social distancing, I'm calling it physical distancing. And it's funny because even though you and I haven't talked about this at all, I've had a very similar outlook on this, where as somebody who is seeing social distancing happening all around me, I've been a social distancer at an Olympic level for like 15 years. So this is really nothing new to me, where I like to work from home. I like to do my own thing. For the most part, I'm very introverted, but now physically we have to create this distance. And what I think is so interesting about that, and also connecting it with this idea of counting our blessings, there are certain things right now that I would never wish on anybody or humanity, which is this disease or these deaths, or I think the much larger fear that frankly most people have is lack of employment and lack of income. I wouldn't wish any of these things on anybody. However, I'm going to be perfectly honest and say there are a lot of really good things going on right now that I kind of don't want to give up and go back to what we called normal, right? So the fact that right now the air quality in Los Angeles has been verified to be the best air quality in the world. Literally, I saw that and I'm like, you got to be kidding me. But they're measuring the air quality, and because nobody's driving, it is amazing to live in Los Angeles right now where there's no drone of traffic, there's no noise, everybody's walking around and taking breaks. And I'm like, if this were LA, I could live here the rest of my life. So I'm seeing a lot of things that, because of the what I've called physical distancing but socially connecting, I found so many people are more connected even though it's via Zoom. Like I had a call with my entire family, and then my wife had the same call with her side of the family, and I'm like, we've never been in the same room in the last 20 years. And now we're all in the same Zoom room. And unfortunately, it took a pandemic for us to get there. But I feel like physical distancing is creating social connection, and kind of goes
Yes.
back to this idea of gratitude. So are you seeing some of those similar things, or are you just so inundated in the trenches that you're not seeing any of that?
No, I'm seeing that a lot. Again, another great question, Zach. Yeah, I refer to physical distancing as opposed to social distancing because we are, for the most part, are social beings. We gather in clusters. We want to have a partner, most of us. So we want to create a family. We are connected with extended families, with neighbors. We go to clubs, we go to events. So humans are, by definition, social beings. So the idea of social distancing at this very scary time, it kind of, for me, it puts an extra stress on people who need to connect. So I refer to physical distancing because that's what it is. I just got an email from a colleague of mine who's going to have a virtual dance party tonight, where we are going to link into this website, and it's going to show all of us, and we are going to be doing dance moves. And I've never done that in my life. And here I am at 60 thinking, I like dancing. How come I never thought about this before? That I have a day off in the future and I'm here. What if I gather some family members and some nephews of mine and nieces that love dancing? Little kids are great. And why don't we have a dance party? Right? Another family friend of us, I will send an invitation to have a social distancing dinner party where we're going to create a menu and we're going to be putting the computer there and we're going to be eating and talking while having dinner. I have a neighbor across the street who, stands on his porch that faces my porch, and then we have a conversation. We talk. We raise here's what I'm taking, here's what I'm doing, and so socially connecting right now, doing what you're doing with what you did with your family through Zoom, having a dance party, having a context of maybe even a singing context, when was the last time that you did karaoke, So those are the things that I think has really brought to surface the need for us to connect even more. I mean, the virus cemented the idea that this is a global community. If any of us had any idea that it's us versus them, and again, not to go into politicization of this, but you know what I'm referring to, there's been in this country, in the world, this divide line that is us against them, us first, them first, or who is competing together first. And I'm hoping that we have learned from this lesson, that we are learning that we cannot operate as one country alone, as one society better than others, because Look what's happening. One country has epidemic, and now the whole world literally is dealing with that epidemic. And again, from an epidemiological standpoint, being that I love science, I don't believe this is the last that we're going to see of this. I think we're going to conquer it like we have conquered all of the other viruses that came before us and all the other pandemics. I think this one is going to be conquered again. And there's going to be other pandemics out there. So let's come together and be prepared. Let's start talking more. Let's start communicating differently. But most of us, let's realize, like the economist did by showing the picture of the earth, that it's our home, that you cannot expect the kitchen and the living room not to be interconnected. It has to for the home to be effective, for it to have what it needs to be able to host us. The world has to connect all the points in there. And this is a perfect opportunity. I must tell you that when I read that the genotype, and for those of you who don't know what that is, the genotype is the genetic component of viruses. It can be the same virus, but have different components because it adapts to different terrain. When I heard that the virus that infected New York and actually came to us via Europe, part of me was actually happy to read this because the pushback that some of my Asian patients are having was just as ugly as it could be, as if they had control over this. So we need to stop this. We need to stop scapegoating people. We need to stop pointing fingers. We need to stop saying we are it and they're not. We need to come together. And there's no better way to come together than to maintain our social connections everywhere.
Yeah, I couldn't agree with all of that more. And I think that just to reinforce what you said one more time, the reason I brought up the social connection is that at the end of the day, the more you socially connect, the more you're going to suppress your immune system because you're lowering your cortisol because you're meeting with friends and you're laughing with them and you're dancing. And it's just another way to have a supplement, so to speak, to be able to strengthen your immune system, to be able to fight this virus. And it's a really fun way to be able to do it and reconnect with people that maybe you haven't connected with in weeks, years, or even decades. So I have one last question. And I understand that nobody has the answer to this. So I'm not expecting an answer. I'm just expecting your individual opinion. You had said, yes, we will conquer this, but I don't think it's going away right away. So in your own personal yet professional and educated opinion, what kind of a timetable do you think we're looking at for stage one, which is we're all stuck in our houses and we can't go anywhere, but then maybe we can go out, but it's going to be limited. Then it might come back again. Like, how do you see the next few months or maybe year going in your own personal yet educated opinion?
Testing, massive testing. It's the only way that we can ensure herd immunity. And herd immunity is when a group of people are immune. So the higher the number of immune people, the less the disease spreads. I think the way for us to know what the next step is for us as a world, and in the US for us as a country, is for us to make massive at-home testing available. Now, what is the difference? I don't believe it's smart right now for people to go into all these mobile facilities the government has set up for people to be tested. If you understand what a nasal testing is, a nasal swab, it's not easy. You have to take the nasal swab and you have to go all the way up your nostrils, not in the beginning of the entrance of the nostrils, not in the middle, but all the way up. What that is doing is, in a way, if you have any viruses there, it's not only going to be a good test sample, but it's also dislodging more of the viruses in the environment because a lot of people will sneeze after that. A lot of people will cough. So I personally, given the high infectivity of this virus, I am not recommending that anybody goes to a testing facility to be tested because if they are infected, they're going to infect other people. If they're not infected, they're putting themselves at risk of being infected. What I'm promoting at the Akasha Center with my colleagues there is at-home testing. What that means is that it's about to be approved. Several companies have developed the test. They send you the test in the mail. You register online, they send you the test. It's a little finger prick, no difference than when people need to check their blood glucose if they have diabetes. So you do that, you put in a little slide, you send that to the lab. It goes to the lab in a self-mailed envelope. It goes to the lab sends us the results within 48 hours. And that we know, number one, yes, you were exposed and now you have immunity. Immunity is when your system were exposed to the virus and you either developed the disease and now you're immune to it, or you didn't develop the disease in severe symptoms. You probably had a little sniffle there, a little raised temperature, but it was not very significant. But therefore, you still had the disease, you're immune. So we can separate those people. They're immune from the people who are not immune. The people who are not immune are the people that we have to isolate even further. The people who are immune, we need to isolate, but we can relax a little bit more. We can allow them to return to work. We can have them wear masks, knowing that, yes, they're immune, they most likely won't transmit the disease or will get the disease, but because it's such a new virus, we still have to take precaution, light precaution, as opposed to somebody who hasn't been exposed. So in-home testing is the way to go. New York is the peak of the disease is this week, and we saw that the highest number of deaths occurred yesterday. They haven't reported deaths yet today, but whereas had the highest number of deaths, it also had the lowest number of people testing positive. And so what that means is that the peak is there. It's peaking. And so here in California, we are expecting the peak to be sometime next week, but I don't know how that's going to go. So I'm recommending to wait for the in-home testing to be available, but to continue their contact via telehealth with their physicians, whoever it is that they want to talk about this, and for them to follow federal guidelines. I personally think that the physical distancing should be in place until April 30th, at least. And then we can take a look at what the statistics showing, what Stanford is showing with the study that they're doing on the herd immunity. The results are going to be back in 2 weeks. By the end of the month, we'll have more data to say whether or not it's safe for us to be out there. And having said that, I think there's going to be a part of the world that's going to come back to normalcy. China is already seeing some of that. They're reporting it. South Korea is seeing some of that. They're reporting it. Some other countries are seeing a decrease in that. But I don't think this is the end of this virus. I think comes fall, we're going to have another wave of the virus because it behaves like a flu virus, even though it's much more serious than a flu virus. But the behavior of the virus is like the flu. It comes out during the cold months. It infects a lot of people, and then it goes away. And so I'm hoping that when the second wave comes, which is expected to be in the fall, that we'll be much better prepared for that we'll have a lot more testing available, and hopefully we'll be only a few months away from a vaccine.
Got it. So I have a couple of quick clarifications that I want to get from you. The first of which, you said that you recommend don't have anyone go and get tested because the situation is such that even if you're not sick, you might end up getting sick because it's not really sanitary. I'm assuming there is a threshold where you would say, okay, based on where you are now and your symptoms, you should absolutely get tested. So that's not a blanket statement, correct? There is a point where you should get tested, I'm guessing.
Yeah. Oh, yeah. And the testing, that statement is only for people leaving their houses to get tested. I'm not against testing at all. In fact, I said what's going to make a dent on this virus is massive antibody testing, which is safe. You don't have to leave your home. It shows immunity, and it separates people in two categories: those who have had and who are immune, and those who are not immune, so that we can separate them into categories. Testing is the most important thing. Once we have the antibody testing, all of our patients are going to receive a notification. I believe we are about a week to 10 days away from having that, according to the FDA, who is looking into a couple of testings that we have signed up to receive. Once the FDA approves those testings, all of our patients will receive the testing at home for them to test. And anybody who, even people who are not our patients, will open that up for them to be tested again. My concern is only about leaving your house to go do the traditional testing of having a swab inside your nose, because that's not having proven to be effective, number one. It doesn't add anything to the treatment. If you have symptoms, I'm going to treat you as if you had it no matter what. Whether your test shows that you had it or not, the treatment is still going to be the same. We only test people when they come into the hospital with severe conditions, and we need to know, is this COVID or is there something else on board? Then we test people. But the testing is being done under a very controlled environment. So for that kind of testing, I think it should be reserved for people who are sick and not getting better. For people who are sick and getting better at home, like most of my patients are, I tell them testing won't change any of my protocol. If you happen to not improve and start having more severe symptoms, I will send you to the hospital, at which time you'll be tested. But at this point, stay with the protocol, do what I'm suggesting, and because the test wouldn't change my protocol either way.
Right. So the last thing that I want to point out very quickly before wrapping up is that obviously the numbers that we're getting are not absolute numbers, because there are so many other people that probably have this. I mean, all you have to do is spend 5 minutes on Facebook and you can see there are 5, 10, 20 people that have actually had this. Yes, they don't have confirmation, but all of the symptoms match up and line up, which means that, and this is my estimation, I want you to prove me wrong if what I'm saying is incorrect. But as somebody that loves numbers and data, my assumption is the mortality rate is pretty accurate, because as soon as somebody passes away from this, somebody has that data and it's going into a record at a mortuary at a hospital. But the number of people that are actually sick with it has got to be astronomically higher than the numbers that we're seeing, which to me says that mathematically the true fatality rate is way lower than it actually is, because so many more people are getting it that are not in the database. But is my assumption correct that just about anybody who would die from it is in a database?
Yes, your assumption is absolutely correct. Not everybody who dies is on a database. Most people who dies are in a database. We have seen several people pass away because they haven't been tested. Their death certificate is not listing COVID, but it's listing a medical condition that they had, cardiac failure, right? Or pulmonary failure or liver failure. They're listing the cause of the death, not what happened, what led them to have liver failure. So, and I can tell you, just recently, I came across about 5 of those deaths that suddenly the person goes into severe symptoms and dies, and we don't have the testing because it was not available by the time that they got sick. And so the mortuaries or the doctors or the families not putting down the precise cause of death. So yes, in that case, I feel we slipped through the cracks of the system in terms of death, but most of those people are being accounted for the reasons that you stated. Regarding the rate of people getting the virus, you're right. Astronomical is the right word. Of those people who are treated, 23 of them, only 3 of them had the test. And so therefore they were counted in this statistic. Now you're talking about 19 patients that I treated who did not have the test and who had symptoms. And I'm pretty sure that they had the virus. So you can see in my small sample, if that's true, then you're having over 90% of people having the symptoms, in my case, and there's no database for me to report this. If there was a database for me to report symptoms without testing positive, I would have done it. But there's no database. The database is only available for people who test positive. So I think astronomical is the right word for you. But then there's also a silver lining here. If that's true, if an astronomical number of people are getting infected and not coming to the system because they're dying, that means that a great number of people is developing immunity. And so therefore the immunity is indirectly contributing to the flattening of the curve. So that's the silver lining. It's like, oh, wait a minute. In Dr. De Mello's case, he's saying 85 to 90% of these patients didn't get tested but had the symptoms. If that's true, then if we can assume that that's somewhat representative of the population out there that other doctors are treating telehealth-wise, then we can say, oh, what Stanford is talking about in terms of the herd immunity, even now, they're studying herd immunity beginning, let's say, in November. I'm talking about now. If that's true, that let's say 80% of people are recovering at home and not being reported, then we are seeing a greater number of people develop immunity and a great number of people who could then donate their bloods to then be able to inject their antibodies into people who are hospitalized. And that's a plea that I'm making here on this platform for anybody out there who's tested positive or who knows they had the virus and recovered. Your blood is in high demand because that blood in New York, they're using the blood of people who have tested positive and injecting in people who are very ill and whose blood shows to be compatible, and they are recovering faster. And so that's an indirect way to vaccinate people, is to inject the autoimmunity or the immunity that the virus has created in other people into the sick people in hope they will get better. So there is a silver lining here in those astronomical numbers.
Got it. Okay. So the place that I want to finish now is asking the question, have I missed anything really important that we need to talk about for people to feel prepared, to have a better understanding of the reality of this versus the politicization or the way that the media is portraying it? Is there anything else that we haven't talked about that you think the average person needs to know to just feel like everything's going to be okay?
Yes, there is. And save the best for last. And that is, we all are all quarantining at home. Some of us have a lot of time. And so clicking on the internet, being on our cell phones or our computer is, the lines or the systems are overwhelmed because of the number of us who are trying to get news. Please, if you are going to do that, I highly recommend that we limit our screen time because it's just not helpful. But if you're going to do that, go to scientific information. There's something called the ecdc.org. E for European Union, europeancdc.org, which is an incredible source of information. And it's, they're validating those information or updating them as we speak daily, several times a day. There is also another website called Our World in Data. Our World in Data is a British website that I'm been following for a number of years, and very impressed with their basically transparency, with their ability to say yes or no to evidence that is being out there, whether the evidence is strong or not. It's all based on data. And at this point, data is our best friend. We have to look at data. So, of course, the CDC is also a site of information, but even more than the CDC, I would go to the WHO, the World Health Organization. And then you can look at scientific evidence published by journals. But let go of the network sites, let go of individual sites where everybody wants to have their 5 minutes of fame, and they're putting out information that is just completely meddling with the middle field. And it's making things harder than they need to. So my last advice as we end this interview is for people to limit their screen time. And if you're like me, who wants to read, who wants to be updated, then go to scientific sites. Don't look for somebody posting something that they heard somewhere, because this is what's really complicating matters out there, is this amount of information that we have to dispel. I'm dispelling misinformation all the time. And the World Health Organization just launched an incredible website called Infodemic. So if you go in there, infodemic.com, it's also amazing because it's showing the danger of misinformation, the danger of making statements. So infodemic.org is also a very good sign. And then if there's something that you heard and that you really want to investigate because you are a science nerd like I am, then go to a website called Snopes. I think it's called Snopes, SNOPES. It's a website that basically debunks all the theories if they need to be debunked, and they tell you why. No, this is not true because blah, 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 blah. It tells you why. So it's also a very good website for you to say, somebody told me that standing on my head is going to help me fight the virus. Go in their website, enter the study in there, and they will tell you whether or not it's a valid study.
Well, that is just a treasure trove, a cornucopia of amazing resources, many of which I didn't even know about. And when it comes to the news cycle and screens and all that, I couldn't agree more. And actually, the very first thing that I wrote as soon as this started to happen was how we need to be way more afraid of the pandemic of fear and how quickly all of the fear spread and the anxiety spread. And I wrote it before the country and the world completely shut down. But a lot of just the fear and anxiety created was from the fact that we are so hyper connected to our devices. And the world that we saw was not the world outside. It was the world that was on our screens, which to me is a junk food that is far more dangerous to your health than a bowl of ice cream. So if you're going to choose between the two, choose the ice cream, not the news, right?
Well, a small scoop.
Small scoop,
pint,
right. Exactly. Not a pint or not half a gallon or anything. But I would say that if you're going to choose a form of junk food, I'm going to choose ice cream any day over, going on the news and online. I couldn't agree more.
And if you're going to use the scoop of ice cream, put a little bit of fresh fruit in there so that you can at least balance it out a little bit.
Spoken like a true integrative medical specialist.
That's right. The other day I was like, oh my God, I want my chocolate ice cream. It was coconut based, but I still wanted it. And I thought, how do I do to make this less guilty? A small scoop, and I added some fresh pineapples because pineapple has quercetin. And I thought, oh wow, pineapple has quercetin, which is one of the compounds that helps strengthen the immune system. So there you go. I can have the ice cream, the coconut based, but yet ice cream with a little bit of the pineapple, and it made me feel less guilty.
Awesome. So the official prescription from the integrative medical specialist is coconut-based ice cream with pineapples and no Fox News. Got it. All right. I will make sure to spread that everywhere and make sure everybody knows that is the cure. That is the absolute cure to getting over this pandemic. So that's great.
There you go.
So we're running out of time and I want to be respectful, but the one area we didn't even get into, which we're not going to be able to today, but it's just this idea of being able to use telehealth as a valuable resource that most people didn't even know existed. And now all of a sudden it's like telehealth is a thing. Again, I don't want to get into it because we don't have the time, but if somebody wants to find you and they want to inquire about telehealth through your facilities, where can I send people?
Oh, thank you. Yeah, telehealth is the way to go. It's safe. Your doctor can zoom in, and in the perfect world, you have a doctor's visit once and twice a year, and then the rest of your visits can be done through telehealth. But that's not safe just yet. So telehealth can zoom in into a rash that you have or description. So I highly recommend that you find somebody that you trust and you let that person be your source of information, or at least be the source that's going to dispel the misinformation. For you to find us, go to akashacenter.com, and Akasha is spelled as AKASHA, akashacenter.com. And you can go scroll down on the top, and you're going to see under services, there's a section for telehealth. If you don't want to do that, if you have a hard time finding it, just email us as info at akashacenter.com, AKASHA center.com. And one of our staff is going to make sure to get back with you and explain to you how it works.
Excellent. So for anybody that wants to do an even deeper dive into learning more about you and your history, learning about what integrative medicine is in general, going down the rabbit hole of supplementation, better health, I have a whole slew of resources and past interviews with you, which of course we had no time to talk about today, but luckily we have the interwebs, and I will put all of those links as resources on the post for this specific episode so people can go as deep as they want to. But on that note, I can't thank you enough for taking time from the amazing work that you're doing right now, literally saving people's lives, to spend 90 minutes on a Zoom call with me and my audience. So I really appreciate it. Thank you so much.
It's my pleasure. It's always good talking to you, Zach. And stay safe out there, everyone.
Thank you for listening to this episode of the Optimize Yourself podcast. To access the show notes for this and all previous episodes, as well as to subscribe so you don't miss future interviews just like this one, please visit optimizeyourself.me/podcast. Thank you for listening. Stay safe, healthy, and sane, and be well. This episode was made possible for you by, you guessed it, Ergo-Driven, the creators of the TopoMat, my #1 recommended product if you are interested in moving more and not having sore feet at your height adjustable or standing workstation. Almost every new person that I meet in this industry starts our conversation with, "Hey, I got a TopoMat because of you. It's changed my life. Thank you." Listen, standing desks are only great if you're actually standing well. Otherwise, you are just fighting fatigue and chronic pain. Not like any other anti-fatigue mat, the Topo is scientifically proven to help you move more throughout your day, which helps reduce discomfort and also increases your focus and your productivity. I'm literally standing on one as I read this, and I don't go to a single job without it. And if you're smaller and concerned the Topo mat might be too big, or you simply don't have the floor space, well, there's a Topo Mini for that. To learn more, visit optimizeyourself.me/topo. That's TOPO.